Welcome everyone to our first webinar for the series that we're doing for this year. I'd like to introduce myself. My name is Barbara, and I will be moderating this session. And just want to do a brief introduction on why we're doing this webinar, and it's really because it's a it's a series that we're doing as a run up to the event of which is REDCON, the Resilience in Emergencies and Disaster Conference. It will be at the United Nations Convention Center here in Bangkok on December, and we look forward to welcoming you all there. Hopefully it's safe to travel by that time. So all our information are in our website, which is www.redcon-asia. I'm sorry, redcon-asia.com, and please follow our LinkedIn, Facebook, and Twitter pages. And just for some housekeeping reminders, you can type your question at the Q&A, and we will have a survey in the end. So please take the time to answer it. And now we have just some polling questions to see where the demographics are coming in. Kang, could you please put up? Okay. As you see for the quick poll, I just like to know from which region you guys are tuning in. Could you please answer? Kang, do we have the result? So we're just waiting for the result. Okay. We're getting some in. So we're going to show the results now. So majorities from our region, Southeast Asia. Great. And the next poll, please. Ken, could you put up the polling, please, again? Sorry, I closed my window. Okay, so most everyone are from the public sector listening right now. And finally, the third one was really fun. How many is wearing pajamas? This webinar. Hopefully, full disclosure to our panelists. Are you in your pajamas right now? No. Okay. The answer is 75% said no, but yes, 17% of our participants. Well done to our participants who are in pajama. So moving on, I would like to introduce our panelists. We are very honored to have two of the most world-renowned organizations in the humanitarian sector and their representatives. So first, I would like to introduce Dr. Maria Guevara, who is the International Medical Secretary of Medicine Sans Frontières. Sorry if I butchered that in French. Doctors Without Borders. She is the third highest ranking official of MSF, and she's passionate about the existing and future impacts of the ecological crisis for the health of vulnerable populations. And we have as well Jessica Letch, Manager for Emergency Operations from IFRC, which is the International Federation of Red Cross and Red Crescent Societies. And she has worked in the aid sector for 22 years in Africa, Europe, and Asia and the Pacific. Jess developed IFRC's first business continuity plan for COVID-19 and the COVID Safe Programming Pilot Guide for Red Cross and the Red Crescent responders. Welcome, ladies. Thank you for joining us.
Thank you.
Yeah, thank you. So like for now, we're going to begin with a few questions. We direct this first for Maria. And so we have a series of questions for this. Sorry, it's going to be like rapid fire. Ken, could you please put up the questions? So just for our attendees so that they know what these questions will be. So first, as you've known how the situation is right now has rapidly changed because of COVID. So first off to Maria, how has the COVID pandemic affected your organization's emergency response?
So hi, first of all, to everybody, and a good afternoon to Southeast Asia, where most of our participants, I understand, is coming from. I'm hailing right now from Geneva, even though I come from Southeast Asia myself. So thank you, firstly, for this opportunity. To answer your question, how has the COVID pandemic affected our organization? Well, I think as everyone, MSF, as all healthcare workers and healthcare providers in the rest of the world, we were neither immune nor spared. And obviously the impact has been massive in our capacity to deliver. We remain humble in the amount of work that we've been able to do, but regardless of that, we've been able to address or make the necessary changes that we felt we could do in over 450 projects in more than 70 countries. To date, just to highlight that from the beginning of the pandemic, we were already in Hong Kong trying to set up projects of monitoring there since January of last year. And we're publishing on a regular by 3 monthly, quarterly, and also 6 monthly, a report to highlight what those activities have been. But for us, it's been rather challenging in the sense that what our two main priorities and focus was firstly to keep our existing essential medical services that we knew would probably be one of the negative, it would be a negative impact of COVID. The other was actually starting and preparing for and responding to COVID itself. For the direct response to COVID-19, it was important for us to have a main guiding principles in how we were going to address this. And the first and foremost was really safety to the patient, but also safety to our healthcare workers. And we took that as a duty to care and duty to protect our patients and our staff. And we know that even early on, even today, the shortages of personal protective equipment is still a challenge. And so that was one of our main focus and one of the main challenges to our projects. And we were framing this to make sure that we focused on the people, we focused on the systems and maintaining the projects, and also starting to focus on the planet itself. So what we did try to do in the challenge that we faced was mainly what we called adaptation innovation. While we struggled, obviously, to open up projects alongside existing services, what we did have to do early on in the COVID was to open in areas that we weren't used to doing, because we know that the epidemiological burden hit a lot the European and the North American borders. So we actually opened projects in Italy, in Spain, even here in Switzerland, Portugal, and in the US, in fact, which is it's a rarity for MSF. And even myself, I was deployed last year to open a project in Detroit, where we focus a lot on supporting healthcare facilities, especially the nursing homes. So much of our work has always been working with the most vulnerable populations. And here we knew that the nursing home facilities were not getting the proper attention that it did. And in Detroit, where we opened projects supporting nursing home facilities, we tried to integrate proper infection prevention and control measures, the zoning, the stress management, especially for the staff. And we did that across the US, but also across Europe, in fact. So if you were to go to look at our June accountability report, from June to August of last year, we opened up 132 nursing homes. We supported 132 nursing home and facilities in that effort to support the facilities with regards to hygiene, knowing that that is super important for outbreak response. We also worked on innovation, working to reach the people that we were already reaching and knew that they were not going to be able to be reached. And that was obviously because of lockdown, because of quarantines, but also the fear and the stigma that comes with an unknown disease. And for that, we working on telemedicine, trying to provide online trainings on infection prevention control, in reaching out to our different patients, whether that was in Eswatini, for example, for our MDR-TB project. We set up a video observed therapy and tried to give smartphones to our patients so they can call in instead of them having to come in, and supported them in that way. We provided mental health services in establishing telephone hotlines for existing and new patients to call in, knowing that that was one of the main issues that we normally find in any emergency response or crisis. Telemedicine was always something that we were doing, but this was very effectively amped up to try to get at least the distance support that we could where we were not able to deploy. At the end of the day, at least from June to August of last year, we were able to deliver 250 MSF projects with COVID-19 activities in 63 countries. We had helped and supported 600 health facilities, and also deployed or delivered over 2 million protective equipment and kits, just to name a few. There were many, many more that we were able to do, but just to say that that's very little compared to the global pandemic response. And we're very much aware that this is not a short sprint, as we've seen, and it will continue to be a marathon. So we're pacing ourselves and how we respond to COVID today, along with maintaining our services in as much as we can.
And what do you think is the percentage of your capacity now being used for COVID compared to your other emergency response?
So I think what's as an emergency actor, we've always, first of all, within MSF, we privileged, or we do have the opportunity to be able to say that we are largely privately funded. So at least 95% of our supports are from private donors like you and me. And that's a huge asset because it helps us to maintain our independence, neutrality, and really focus on impartial needs that is usually required in crisis settings. For COVID, we launched early on in March a COVID-19 crisis fund, projecting probably that we will need over 150 million. And we were able to raise up to 110 million of that so far, at least till August and November of last year. To date, we've spent over 77 million of that funding, majority of that going to human resources and medical activities. But we were also able, despite the lockdowns, et cetera, we depended a lot on humanitarian support, flights, and facilities to deploy over 1,400 of our staff to the field, even though the lockdown was quite challenging. So despite this, we tried to pre-prepare, and preparedness, emergency preparedness is key in any emergency response. And fortunately, we were quick enough to ensure that it didn't touch too much our normal funding streams to be able to maintain the rest of the activities that we do.
Wow. So like you were able to maintain separate funding schemes. That's great. That would not be that.
Challenging in it. So yeah, a lot of kudos to all our staffs around the world and all our offices that support us.
That would not be the case for a lot of organizations. So wow, kudos to MSF to be able to do that and continue all your non-COVID related emergencies in check along with that. So great.
And just to say, and I think this is why part of our principles is accountability and transparency, and I think this is partly why we want to make sure that we are continually reporting to our donors to really show what we are doing with their support that they're giving us.
And was there, I mean, you were able to get different funding schemes, but were there still like adjustments that MSF has to do in terms of COVID?
Well, I think one of the big collateral impacts of any emergencies, especially outbreak, we know there are knock-on effects to existing facilities, and that was a challenge. Of course, we've had to, unfortunately, in some cases, have to close some of our projects, especially in the conflict areas, just due to the conflict itself, but also being overwhelmed and to protect our staff and patients. So those were obviously happening. But one of the things that we knew that we would expect, especially, for example, for sexual reproductive health issues. And we know that in the experience in Ebola, and that was one of the main things that fell out. And in the wake of the Ebola in West Africa, for example, we knew that the maternal mortality rate skyrocketed after because of the drop in the facilities. And we're struggling to do that today, but we're trying to maintain that. And one of the things we're trying to do also and in the International Women's Day, we did push for self-care and empowering women to better care for themselves. And so we were trying to push self-management of their own medication treatments, self-testing. We tried to establish that. And also self-awareness and self-education to empower the ones that we knew would fall out and be more vulnerable in this situation. So while there is a struggle, one of the things that's interesting about COVID is it pushed us to be more innovative and to really think outside the box as much as we could to try to reach the patients, especially considering the stigma and the insecurities that one would face in some of the settings that we work in.
Wow. Thanks for that.
Yeah.
Interesting reporting from MSF, and again, congratulations for being able to raise separate funding for COVID. Now I'd like to direct the same questions to Jessica and see where IFRC is working at as well.
Thanks, Barbara, and thanks also everyone who's joined the discussion. It's a really important conversation to have because there has been so much change in these last 12 plus months, and so it's really critical that we continue to learn the lessons and focus on how we can build back better from the experience. I did prepare a few slides. I always like a few slides, and I like the sort of extra color and flavor that they give sometimes to these otherwise sort of dry topics sometimes. So I just wanted to run through those first questions that you mentioned. So actually, in addition to COVID-19, 2020 was also our biggest, busiest year in terms of emergency operations in Asia Pacific. We supported 53 emergency operations in 19 countries, and the most common of them were floods and cyclones. We also had epidemics and earthquakes, not only COVID-19 epidemics, including dengue, for example. But our smallest and largest operations of the year were related to people movement, particularly displacement from Myanmar, and our largest operation last year was for Cox's Bazar people movement operation. And then came along COVID-19, which has become the biggest emergency appeal that we have launched within the Red Cross and Red Crescent, where just for Asia Pacific, we've been seeking 95 million Swiss francs. And over the last 14 months, we've been able to mobilize among the 38 different Red Cross and Red Crescent national societies, 7.5 million volunteers. It's been an enormous effort, an enormous reach, and we continue to work directly on the different elements of COVID-19 programming. And that relates to the health impacts, the socioeconomic impacts, and also strengthening national society capability to rise to the challenge of COVID, to continue responding to disasters and crises, which continue to strike the region and cause their compounding effects. Also the heightened risk faced by Red Cross and Red Crescent first responders, and the less direct support that we're able to provide due to many of the limitations that are now in place. I guess it's useful also to reflect upon some of those first major operations that were taking place concurrent with COVID-19. So some may remember Taal volcano in the Philippines, which resulted in major evacuations due to ash fall. Cyclone Harold, which struck Fiji and Vanuatu, and also Cyclone Amphan, which struck primarily India and Bangladesh. You know, right from the word go, we had significant challenges in relation to supply chain. Manufacturing sectors were closed down, and also transportation links were, were shut down in many cases, freight and also the movement of people. Ports became blocked. Fumigation requirements were suddenly introduced without necessarily clear procedures around how they should be operating. The movement of people became an issue not only international, which I guess is what people often think of when they think of the Federation, that we're working across these countries and moving in to support our national societies, but also within countries with lockdowns and people's ability to, get to the office or get out to the field. And of course, the heightened risk to the affected communities, the risk to personnel, not only risks that might come from their work with the Red Cross or Red Crescent, but just the background prevalence of COVID-19, which continues to grow in so many countries. And then the disruption to business continuity because of the lockdowns and also clusters that might emerge within staff. So 2020 was a very challenging year, and we're continuing to see some of the impact of those challenges in 2021. I think anybody in any workplace has has experienced many of the same challenges and has come up with many of the same solutions. I guess for us, it's been, an expanded version of that, because we're working in virtually every country in the world. We are a membership-based organization or federation, so therefore we have separate national societies in every country of the world, and they're all needing to manage their own systems in order to continue to provide services to vulnerable people. So there's been a great digital leap forward for so many industries and sectors and organizations, and that certainly happened even down to the branch level in some of the rural and remote areas in the Red Cross and Red Crescent organizations. Prepositioning stock and people has been something that has been we've been working on. However, it's not always easy, because the way that funding works is that funding often becomes available after a crisis starts. Moving stock in anticipation of an event costs money, getting it through customs, paying for warehousing, etc. And similarly with people, we urged all of our officers and also national societies to make sure that their vacancies were filled, and that they didn't find themselves with weakened teams in a time when COVID could come in and further weaken their capability. Moving a lot of our work online, as this has we're also doing for this seminar. But we did a lot of regional training and a lot of work, developing standards and rolling them out across the region. So it has meant that what would once have been maybe a face-to-face training for several days, and needs to be broken down into little bite-sized chunks that are able to sustain people in online formats. And actually, there's been a great participation revolution as well, because it's very costly to bring people together face-to-face, but online we can reach a larger number of people. Remote deployments. The Federation's role is to support Red Cross and Red Crescent national societies when a disaster or a crisis strikes that is difficult for them to maintain with their own regular resources. And so often that involves providing financial assistance, but also technical support, and also people to help them with that surge. It has been difficult. I think the Asia Pacific region is the region in the world that has experienced the strictest closing of borders. I know our colleagues in Africa and Europe and Americas are moving much more freely than we are, and I don't think that we will see a change to the situation here in the near future. And so we've had to shift a lot of what we would have done side by side with Red Cross and Red Crescent. We've had to shift that to the online space. In some cases, that has been seamless and it's worked really well. In other cases, especially where we need to really be working to champion certain issues or to really convince people of the importance of certain things, it's much harder to do over email or sort of short meetings. So this has been challenging, and the remote deployments has been a great gain in efficiency, but it also has its limitations. Business continuity planning is something that now we're doing much more effectively, and also the COVID Safe Guide, which I'll speak about a little more. This, I'm not sure how others respond when they see this. This is not a Red Cross photograph. This is from Reuters. But this picture came out in May 2020, when really we were at, I guess, the height of the first wave of COVID-19. And this is an evacuation center in Bangladesh from Cyclone Amphan. And, knowing what we know now, we can see just how much risk is associated in setting up a cyclone shelter in this way. In Bangladesh, they also had the challenge that a lot of the facilities that are commonly used as evacuation centers were being used as quarantine and isolation facilities for people. So they had many less facilities available for people at a time when the cyclone came through, and so this was the result for one organization or one community that was sheltering its people from the cyclone. In contrast, this is a Red Cross, Indian Red Cross cyclone shelter in response to the same emergency. And Of course, you can see that there are ways in which we could improve the situation, but generally speaking, we've got much more COVID-safe way of working, and this is in the very early stages when we were still really institutionalizing our approaches. And this is more of what we wanted to see, and became the inspiration for the COVID-safe pilot guide, which we've developed and disseminated in the region. The COVID-safe pilot guide is like a field manual for first responders and operations managers to get really simple, practical guidance on what to do. You can find plenty of resources on how to do how to be COVID safe in your programming, but often it's very lengthy, it's very technical. There's a very extensive guidance for each sector, and what we tried to do was just to boil it down to its critical points and make it put it in plain language and make it easily translatable and easily disseminated to people in many different contexts within the Red Cross and Red Crescent. And so we've brought it down to 4 critical actions: plan ahead, ensure physical distance, ensure hygiene, and identify and support vulnerable people or those with symptoms. And then for each of those 4 actions, we've looked at how to apply them in a series of different areas of work. So you can see there are general precautions: managing an office, managing people, working out in the community, managing facilities like distribution centres, managing distributions themselves in camps and camp-like settings, assessment, planning, monitoring and reporting, and also humanitarian access and advocacy. So we've kind of tried to use these 4 steps in each of those critical contexts. So you can pick up a section if you're managing a camp or a camp-like setting, and you can run through what you need to do. And so this is an example section. You can see it's managing people. The PA means plan ahead, and we need to brief our volunteers and staff, purchase hygiene kits and thermometers that can be deployed to any staff that are infected and in isolation, nominate a team of workers to champion safe practices, etc. And so it's designed to be something you can easily pick up and get some really good practical ideas on how to move forward. And so just a couple of pictures. Here's a Philippine Red Cross cash distribution. So here we can see social distancing in the queuing system while people wait. We can see really good ventilation using the outdoor space. In the same distribution, you can see a hand washing point that was set up for people. This is in Indonesia, putting up this information and education materials around hand washing and hygiene. And also here in Indonesia, setting up temperature checkpoints and registration systems for contact tracing when people access a service. So I just wanted to share with you those pictures and examples of the work that we're doing. And you can see below there's a link to the COVID Safe Guide if people would like to have a look at it. It's a pilot guide. We're hoping to actually incorporate more learning and improve it as we go. And also we'll touch on a little bit later some of the work we've been doing in disaster law. And there's a link there as well to the disaster law work we've been doing since COVID. Thank you.
Thank you, Jessica. How that was evacuation plus quarantine facilities. Wow, that must have been very. I mean, IFRC has like 192 chapters globally. How were you able to make everybody get the guidelines out as fast as you could, or do best practice when things are just moving forward? And how was IFRC able to do that?
Well, I mean, firstly, 192 Red Cross and Red Crescent national societies. Every national society is its own independent, locally run organization. So American Red Cross, Fiji Red Cross, Afghan Red Crescent, they're all run by local people leading their own operations. Here in the Federation, we're here to support and coordinate when, when assistance is needed, when international assistance is needed. Yeah, it's been challenging. And in fact, a lot of what's in the COVID guide actually came from the good practice that we saw among our member national societies. So in particular, as mentioned, with the Taal volcano response, which was already happening when COVID struck, the Philippine Red Cross, who have a really strong health focus, were pioneering this work in the very early days. And so we learned a lot from what they were doing. We learned a lot also from Indonesia, Bangladesh, and also in terms of disaster law and regulatory frameworks. We learn a lot from our experiences in the Pacific too, with Vanuatu and Fiji. And so it's been a two-way process. We're learning from our members on the ground, and we're also feeding those lessons back in. And as mentioned, it is primarily through webinars, emails, sending these tools out. I have an operations coordinator who's Indonesian, and we managed to send her to Indonesia in response to the West Sulawesi earthquake that happened recently. And so she was actually able to take the COVID Safe Guide herself. It has a little Word document self-assessment that you can do. And so she was actually able to go through it with her team physically. However, we can't rely upon physical deployments anymore. We have to find other ways to convince, support, encourage, advise our members in order to help them to protect the people they're assisting as well as themselves.
And because like how big the federation is, and must have been, was there kind of like have to be prioritization that has to happen on during this deployment?
Yeah, I guess we are applying these principles to any new emergency operation that strikes and encouraging people to pick them up there. But the guidance is relevant to anybody managing any team. And so therefore I guess it's really for the national societies themselves to prioritize this work. And often they realize just how important it is when the background rate of infection starts to grow within their own teams, because I guess people might be picking up COVID, catching the bus or from their partner or from their, from their trips to the market. And then if you're not running a COVID safe office, then they might be creating a cluster within your own office. And we have seen this happen in many workplaces, including some of the Red Cross and Red Crescent offices. And that's when we're able to come in and provide a handy tool to help to support and prevent further outbreaks.
That yeah, I mean, just the how huge IFRC and your chapters is just like mind-boggling sometimes on personally on how you would have to prioritize things for that.
Yeah, I mean, the issue of scale is always massive, especially in the Red Cross and Red Crescent, because we have 192 national societies, but Philippine Red Cross then has 100 branches, and so everything that you do could potentially drill down to the village level. So the dissemination effort is massive.
Yeah. Thank you, Jessica. Wow, the very interesting presentation. I'd like to bring back Maria and Jessica for just with everything happening right now. I mean, what you've started for your advocacies for 2019 must have really been affected by 2020 pandemic. Maria, I'd like to start with you. I know you've been championing planetary health, not just for MSF itself internally, but also externally. How has that been affected by COVID?
Well, first, I think what's important is, advocacy is a very challenging term for MSF in general, because what we tend to do, or historically has been more about témoignage or witnessing, is basically reflecting what we see in the field that we feel needs to be given voice. And what we've often done when we advocate is to highlight the inequities and inequalities. And I think, if anything, COVID has probably made that even more vivid in everybody's face, right? I mean, I think the world, there's some sense of flipping of orders, and where old humanitarian hotspots and old barriers there are now new frontiers, and everybody's been affected in one way, shape, or form. So it may actually make it more evident as far as what does vulnerability really mean. So it's given voice to that. Now, COVID, however, is what I think a dress rehearsal to in the short term of what climate change is in the long term, right? So climate change seems to be more of a slow burn, and if we don't do anything today, we'll probably be burnt at the end of it, if I can say it that way. But like you did say, within MSF in the last few years, we've been really more actively pushing climate change, environmental degradation, and in one section of MSF, we've been calling it planetary health, only because of its much more inclusive framing, which includes not only climate change and land degradation, but also includes biodiversity loss, the food and water insecurities. And we know that there's a huge focus on biodiversity loss and land degradation that contributes to zoonotic diseases, which are the main sources of emerging infectious diseases. So COVID is very much one of those outcomes of that. So it's again strengthened our framing of planetary health and our speaking out on this. But the way we're approaching it is through three different pillars of operational adaptation. How do we really do our operations better? How do we do better preparedness in emergencies? So projecting how do we, what kind of scenarios would be ahead of us as far as crisis. We're also looking at it from the environmental footprint, the do no harm kind of principle of mitigating our own responses in a way that we don't leave projects and the environment in worse condition than when we came in. So we feel like for us to advocate on anything, we need to at least first look at our own footprint. And then finally, is the advocacy arm of really giving voice to the climate witnesses, those who are most affected. And more we hear from our patients and our staff how they are increasingly affected by climate change and environmental degradation, and paying more attention to that and giving voice to that. While we are a group of doctors and medical practitioners, paramedics and logisticians and others, we are not necessarily the scientists that really drills down on these research, but we do have the field experience that we can add to that, the evidence, and we're working to build that capacity so we can speak more clearly and more evidence-based to add to what's already in a plethora of science that's out there already. So that's what. So I think it's only been reinforced because of COVID.
I think at the ground, experience sometimes really trumps whatever science-based
Research,
that they're telling us. It's I would think being on the ground trumps that. How about for IFRC, Jessica?
Well, in terms of advocacy, I guess it has expedited some of the advocacy work we've been doing, and we've learned a lot in other areas as well. So, I mean, localization is a huge platform of ours in terms of locally led responses to disasters and emergencies. And, through the inability to move people, we have also seen a lot greater local leadership of emergency response. It's had its challenges, of course, because, we're there at the request of local people because they require and would like to have assistance from us. But it has also sort of seen a fast tracking of that agenda. Epidemic preparedness was also something we'd been arguing for a long time. So clearly COVID has been a great lesson in the importance of epidemic and pandemic preparedness. We also now are sort of focusing more on the immunisation piece, not just around vaccine hesitancy and rollout of COVAX, but also in relation to other immunisation programs which have suffered as a result of the reduction in access to healthcare that's happened across the world. But one area that's quite interesting in terms of advocacy relates to our disaster law work. And the increased, the huge number of regulatory issues that can impede humanitarian assistance in disasters. And that it really, having this global disaster which affected every country, meant that this potential really showed up under COVID. And we learned the importance of legal and policy preparedness for not only for disaster response, which we were well aware of, but also for public health emergencies. It was an area that was under-researched, and suddenly we were in a situation where it was a public health emergency that was shutting down the movement of people, goods, assistance, not only to countries, but also within countries. We learned that we need to engage with health structures, not just disaster management coordination structures, because, and we also learned how to better support those coordination structures. We learned that we need to argue that Red Cross and Red Crescent do need to be counted as essential services. All humanitarian workers are essential services during lockdown, and make sure that it's properly accounted for in policies and procedures. And also, we've been able to do a lot more research and develop recommendations on disaster law in order to ensure that kind of preparedness. And that's where the link I shared in the presentation, which can be made available to others. We're actually going to be launching that later this month, and people have an opportunity to hear more about that work that's been underway.
Oh, so great that you've also touched on policy issues that need to be addressed for situations like this. What about you, Maria? Would you think that there's any policy, innovative policy that people, governments or institutions can address so that it will strengthen and help the situation?
I mean, I think Jess has mentioned the importance of localization, and I think one of the main issues that's been missing in the global health stage is the actual community voice, the voice of the people. And if any policy change has to happen, it has to have that voice. And I think we need to relook at what multilateral systems are. We know that there is a challenge to making structures like the UN, etc., function as it is. But what it needs to happen is that we need to have a more inclusive, real, equal voice around the table, and that has yet to happen. And I think COVID has really pushed the issue of solidarity versus sovereignty. And I think we need to relook at what that means for all of us, because it's really telling us no more of the old ways. We need to look at the new way of really working collectively together in a humane way. And if we don't include the voices that are the most affected, then we're starting from the wrong home place. So I think, yeah, if there are any policy changes, begin with inclusive voice.
Thank you for that. Actually, one of our things that we're doing with REDCON is the theme is a people-centered approach, because really everybody keeps on doing things but not actually really thinking about how the truly affected will be helped or harmed by it. So that's why we are also looking at people-centered approach. Thank you for that. Wow, we have a lot of questions, so we're gonna go through this. First question is, can you describe some of the innovations that you undertook? Has remote medicine take a new approach, and will this remain a feature? I think Maria, you talked about this.
Yeah, for sure. I mean, I think it was already something that we were looking at, and one of the things that at MSF has always been to it's about access, right? It's access to healthcare, access to the people, access to whatever. And sometimes that's a very, very operational issue and challenge, whether that's on conflict settings. And sometimes that's just making sure that we're able to have the proper diagnostic capacities as much as the proper testing and treatment available to the field. And we've used a lot of innovation, whether that's e-healthcare, for example, to have an app actually by the for the caretaker, whether that's a national or local staff or even an expat staff, can have at their fingertips a diagnostic kind of algorithm to help them do better diagnosis of cases on the field. So we have that. I've already mentioned that for many years we've already started to telemedicine, and we've only expanded that because of COVID. We've also gone back to the usual hotlines, right? Of support. I mean, that's a usual thing, and now we're using it even more. So I think, you know, there is a real value to innovation, but it's not only innovation in technical terms, it's innovation in thinking and ideas of how to approach community more locally. And sometimes that means going back to basic. And one of the things that's come out of any outbreak response, and we ourselves have to learn it constantly, and we've already mentioned it before, is reaching out to the community. So when we say person-centered approach, that's the patient, but also the community. And how do we get with them at the field, at the local level, and really understand and talk to them? And that means going to them and not talking through a steel instrument. So it's also rebuilding that human bridge.
How about you, Jessica? What are your experiences on this?
Yeah, I think the innovation for us has been more around process innovation rather than, you know, new technology or technical solutions. I'm as in product innovation. We have had a great digital leap forward, as I mentioned, with a lot of things moving online, and also because of this massive size of the operation, we've done a lot of work with data, and you know, it's just been very challenging keeping tabs on what those 7.5 million volunteers have been achieving in their time. And so, you know, it's really resulted in a bit of an information management revolution for us. Yeah, I started in my role here 2 years ago. I didn't know anything about a Power BI dashboard, and now I would say I'm the #1 champion. I'd also never used Teams, and now I'm also right there. I've even today managed to master Zoom without any problems. So, you know, in terms of technology, of course, there's been a huge leap. But there's also been that advancement in thinking, as mentioned, in relation to business continuity planning, contingency planning, preparedness when it comes to our own internal work, but also our engagement with partners and with governments as well. So I think we've seen, we've learned a lot, and we've also come through with a lot of new solutions. And the COVID Safe Guide is another example too of somewhere where it's a way in which we've been sort of thinking ahead in order to try to prevent risks and mitigate the worst impacts of these events.
Oh, wow. Yeah, everybody has to innovate nowadays. The next question is about mental health, actually. So during the new normal, as we are called, a lot of restrictions are imposed. How does IFRC or the humanitarian movement in general respond to non-communicable diseases, anxiety, stress, depression that arise due to COVIDs or disasters? Maria?
Sorry, let me unmute myself. I think that's the term, right? Oh, sorry, I was mute. Yeah, so mental health has been, again, you know, even before COVID, something that I think within the humanitarian sector and even in general, you know, in healthcare system in general, it's been a struggle to put mental health on the table. And we have, at least within MSF, trying to integrate it within our projects and our systems systematically for the last decade. And COVID has made it even more important. And I mentioned earlier that I was also deployed last year to open missions in the US. And what was very, very stark to me was the importance of actually providing not only mental health support to the patients, but it was mental health support, peer support, psychological first aid to the healthcare workers. I think in many areas of the world, as a humanitarian sector, we are, you know, we're exposed to such massive, some mass casualties and real breadth and scale of disasters. But I think COVID for many, that was not always the case, and the trauma that the healthcare workers have had to face across the globe was something that was very palpable in my face and in the organization's face. And so we amped up that support to highlight how we did it, how do we do it in MSF, how do we support our staff as much as our patients, and how do we integrate that in our system, and what kind of mechanisms can we put in place, etc. So that was an innovation in a way of of really relating our experiences to countries like the US, where you would think that was inherent, but it's not. And I think those kind of setups was very, very important for us to acknowledge, which only, of course, reinforced the capacities we were trying to build in any case pre-COVID within our own organization.
Jessica, you have something to add?
Yeah, so I mean, in terms of supporting personnel, it really has been a challenging time. We've got many people who are working from home, sometimes without good equipment, and under lockdown, with kids home, homeschooling. The impact on women's been especially acute during this time. We've had, apart from the issues of just being able to get yourself online and get yourself working, the OH&S concerns that are coming from people who've been sitting at kitchen tables or on couches where the furniture store has been closed because you're under lockdown. Even if you did have the money to buy a good chair, you couldn't actually travel to purchase it. And so we've had a lot of complex challenges from the purely physical and practical, as well as the psychosocial. And we've had to really invest a lot more in staff health and staff support and guidelines for staff and volunteers across the whole operation. Insurance, and also a kind of solidarity fund where some countries might have difficulty insuring staff and volunteers, making sure that people are practicing COVID safe programming and working so that we're not exposing them in the course of their work, tackling fear and stigma that might come, especially if there are outbreaks or cases within staff, which might make people afraid to even be coming to work or conducting their work. Adjusting policies in relation to quarantine and isolation periods, sick leave policies or end of contract terms and things like that. It's quite a big shift to have to incorporate these things. And also thinking about things like time zone issues for people who are working remotely. In the early days, we had a Kuala Lumpur-based staff member who was virtually deployed to a cyclone response in Americas, and business hours there are 8 p.m. till 5 a.m. This takes its toll on people having to adjust to these ways of working. And also there was another question there about PPE, and very early on we knew that the supply chain was very challenging, and we took a kind of no regrets approach towards getting ourselves in the queue to purchase PPE and masks in particular, as well as other medical consumables, with the idea that we should just invest, try to get the goods that we can, because as you see, 7.5 million volunteers, we certainly didn't succeed in obtaining 7.5 million masks in the first stages. But we can, if this thing called COVID happens to not become such a big deal, maybe we could still use them for the haze or for forest fires in Indonesia or for other purposes. So, we had to make those decisions very quickly in order to try to maximize the opportunities that we had, in this massively jammed global supply chain that occurred back in the first half of 2020.
Yeah. My God, yeah. I mean, there are no, there are like disasters and hazards are happening all the time. There's no let up. So for sure you were able to use your your supply for that. There's a question here, and unfortunately, sorry, we're going to be short on time, so we will try to answer all the other questions in an email or so. But to both panelists, what is your most important takeaway for international organizations that you would share out your learnings to? Let's start with you, Maria.
Wow, that's a huge question. You know, I think I already said it earlier, but I think one of the main things that we've, at least from my experience working with MSF and within MSF, just to say it's Médecins Sans Frontières. But in any case, and I think one of the, you know, in a situation like COVID, but when we start to talk about health security, I think it's important to understand that health security starts with the individual in as much as the collective. And if you don't respond and address the individual concerns, then you cannot have a collective security. And I think a role of MSF has been to really give voice to the vulnerable individuals out there, and we cannot forget them in protection of our own selves. And I think as a humanitarian organization, that is always our call, is that, you know, we are only as safe as the weakest links. So maybe that I will leave it there. Thank you.
You, Jessica?
Yeah, perhaps in a similar vein. I mean, it's really shown us front and center that we are nothing without the people who are working every day to support vulnerable people. And it has really shown us front and center how important it is to keep them safe, to make sure that they're supported in every aspect of their lives and their work, and in order to maintain that ability to continue to address the compounding crisis across the region. So I think we have realized just the power of humanity, as well as the importance of looking after these, you know, all of the communities, and to ensure that resilience and to continue to support them.
Yeah. Well, again, thank you to our wonderful panelists. I know you guys are busy, and thank you for taking the time to join us here for this webinar. Thank you to everybody who listened and asked questions. Like I said before, we will send you the answers to all the questions that has been put in here. And we do have a survey of for this seminar. So may I ask that you all partake in answering it and emailing it back to us. And with this, we close this webinar. Thank you so much, and see you all.
Thank you.
Thank
Thank
you.
you. Goodbye.
Bye.
Bye.